Since RFK Jr. and President Trump held a press conference on Tylenol and autism, my cell phone exploded with tweets, emails, and messages asking for me to uncover the truth. Interestingly enough, I was actually working on a video for a new Truth or Scare episode on the association between Tylenol and autism. Now, I wanted to come into this video very level-headed, relaxed, just to talk about the facts, cover what was wrong, cover what was right, but this press conference was just so bad. So full of inaccuracies, lies, judgment. It literally depressed me to see how far we've fallen. I've said that the information I present on this channel is not political, it's clinical. But what I really meant was that it isn't partisan. For the last few years, partisan politics have destroyed our credibility as healthcare professionals. Truth and facts have progressively become devalued in comparison to winning. And before your mind goes there, this isn't a left or right thing either. Whether it was President Biden announcing boosters before the CDC and FDA even approved them, or President Trump pushing hydroxychloroquine as a game changer while his own NIH rushed to fact check him. Even Vice President Kamala Harris has played this game, claiming she would not get Trump's vaccine, only to get it several months later. The problem is just universal. And now with this autism press conference, we've sunk to an all-time low. It's no longer political theater, but more like a partisan soap opera. Listening to the words Trump uses in this one single press conference. Whether you're liberal or conservative, it's truly abysmal. I don't mean this from a political correctness standpoint. I mean this from a scientific communication standpoint.
And by the way, I think I could say that there are certain groups of people that don't take vaccines and don't take any pills that have no autism, Is that a correct statement, by the way? See, Bobby wants to be very careful with what he says, and he should, but I'm not so careful with what I say.
Imagine your own doctor repeating those lines to you.
This is based on what I feel.
Scientific press conferences are not supposed to be about how you feel. It's not even about how experts feel. It's about what the evidence shows and to what level it shows it.
I'm not a doctor, but I'm giving my opinion.
This literally reminds me of one of those stupid shirts at Spencer's that say, "I'm not a doctor, but I'll take a look." This isn't comedy. This is what folks will use to make their health decisions. Some of the press conference is even uncomfortable to listen to. Look, I point out that political correctness can stifle speech that could perhaps give us a better understanding of reality. In fact, I've even been called fat-phobic and have had to defend myself for encouraging weight loss in those who are obese. But the way the president discusses these topics, it's just gross.
Like an Ozempic, or I call it the fat pill or the fat drug. Sometimes it works, I guess, for people. The ones I've seen, it hasn't worked so well. I got a lot of friends, they're fat. They said, "Yeah, I lost some weight." I said, "You don't look it to me."
We've blurred the reality between podcast hosts who straddle the line between comedy and politics with the president who makes jokes at the expense of accuracy and others' well-being. But let's get to the science. Throughout this press conference, President Trump repeatedly says,
"Don't take Tylenol. There's no downside. Don't take it. You'll be uncomfortable. It won't be as easy, maybe, but don't take it. If you're pregnant, don't take Tylenol, and don't give it to the baby after the baby is born."
Well, as a board-certified, actively practicing physician who's been in practice over 10 years, he's flat out wrong. In healthcare, every decision has consequences. Taking or not taking a medication both carry sets of benefits and harms. That's because medications, therapy, surgeries all have biological, psychological, and even social implications and trade-offs. And what's even more interesting is that those benefits and harms will be drastically different depending on which individual we're discussing. All this is to show that I'm not making an appeal to authority argument here, saying that Trump isn't a doctor, so he must be wrong. I'm actually saying he's wrong because he's wrong. If he was a doctor, he would know that not treating a fever, especially early in pregnancy, can carry serious risks. Elevated temperatures from untreated fever, even hot tubs or saunas, are consistently associated with higher neural tube defect risks in the fetus. This has even been applied to other parts of development, including increases in congenital heart defects and orofacial deformities. So no, we don't just give Tylenol for comfort during pregnancy.
There's no downside other than a mother will have to, as I say, tough it out a little bit. There's no downside to doing this. It's not like, oh, if you do this, you're going to die. There's no downside.
His tone about toughening up is not just judgmental, but inaccurate. What's ironic, the topic of lowering fevers is uniquely interesting to me because I've long discussed that we need to decrease this obsession that we have of routinely lowering a fever. So often a patient of mine says, I've been taking Tylenol around the clock to lower and control my fever. But that's not always necessary. A fever could be a good thing, but some can be problematic and are not okay. That's the nuance that's necessary. Trump also proudly highlighted how his team has cracked the code for why autism rates have increased in the US. He blamed it on two things, sort of. And I say sort of because he's not the clearest communicator, especially when it comes to statistics.
And you know, we have something else called favored nations where I'm going to be reducing drug prices by 1,000%.
Trump implies over and over that Tylenol causes autism. And his director of the FDA quite literally said that on Fox News later that night.
Well, I'll tell you, the biggest study was done by Harvard and Mount Sinai. They looked at 27 studies showing an association. There were 4 against it, and they said, based on the overwhelming body of evidence, there was a causal relationship. Those are the exact words of the dean of the Harvard School of Public Health.
On the surface, I realize that sounds terrifying. Tylenol is our go-to option for pain and fever in pregnancy because NSAIDs like ibuprofen and aspirin have well-proven risks. It's literally on the safe medication list that I give to my patients in the OB clinic. Here's the interesting twist. Their claim isn't totally made up. I pointed out earlier, I was literally working on a video on this exact subject. For years, researchers have studied the possible links between acetaminophen and autism, ADHD, and other developmental conditions. Some of those studies do show associations, and some show biological plausibility, especially in animal models, which means that it is possible that Tylenol may play a role in autism development. But when someone like RFK Jr. cherry picks that data to support his pre-made conclusion, it can be sold to sound very convincing. That's the big problem here. The data should lead to the story. But if you already know the story, you made it up in your head, you're not doing the science, you're doing marketing, or in this case, politics. Consistently, this administration misses the cornerstone of scientific research. Correlation does not equal causation. There's a lot to unpack in many of these studies. There's many variables and confounders at play. Just think about it. Who takes Tylenol? Those who have fevers or pain, basically people who are sick. Perhaps the association of sickness is stronger than the association of Tylenol use. Did RFK Jr. bother to even check? Anyway, let's zoom out and look at some real information. In 2021, over 90 scientists signed a statement that pregnant women should be cautious with Tylenol. Not to stop it, not to ban it, just to be cautious. Which really, I feel like that should always be the case with medications. Fast forward, the biggest study came out this year in Sweden, not in the US, looking at over 2 million children. When they compared siblings, one who was exposed to Tylenol, one not, boom, no increased autism risk. That's really powerful because siblings share genetics, environment, and parental health habits. So if Tylenol was truly to blame, you'd expect a signal there, but it wasn't. Other big studies since then? Same story. Maybe a slight association, but when you control for confounders like genetics, illnesses, and environmental exposures, it mostly evaporates. How about the fact that the use of Tylenol during pregnancy has gone down or stayed stagnant in recent decades, yet autism rates continue to grow? Less Tylenol, more autism. Doesn't make sense. Translation, the Tylenol autism link is not proven. Now here's where I get frustrated. Trump, RFK Jr., and the rest of the administration presented this like a settled fact when it's obviously not. Even the author from the Harvard School of Public Health, who was misquoted, by the way, by Dr. Makary, clearly said further research is needed to confirm the association and determine causality. He sent that in his message to Trump's team before the press conference. Now, there's a world of a difference between there might be a risk here that's worth studying and this definitively causes autism. When you nix nuance and mix that messaging with partisan politics, people lose trust in us, actual doctors. It also pushes some to avoid Tylenol when they really need it. Will people actually get hurt as a result of this press conference? Sure. I actually don't think that's unreasonable to expect. Truly, this is part of a bigger pattern. RFK Jr. and other politicians have built their careers on overstating scientific uncertainty, especially with autism. First vaccines, now Tylenol. Same playbook. Highlight just enough data to sound convincing, then exaggerate the conclusions. And Trump? Well, he's seizing on that to look like he's saving the day by taking on big pharma or small pharma, over-the-counter pharma, even if it means twisting the science. It plays well to score political points, but it's a disaster for pregnant patients who need honest, balanced guidance. It's even a bigger disaster for us who actually want to find the actual reason for the increased autism rates. RFK earlier this year said he'd find the cause of autism by September. And when he obviously didn't find it, he just chose an explanation that might fit. So if you're watching this and you're pregnant or planning to be, what do? First, stay alert, not anxious. Nothing in the newest research proves Tylenol causes autism. And if it does, I promise I'll be there to make that announcement. Second, keep using the rule we've always relied on. Lowest dose, shortest duration, only when the benefits outweigh the harms. Third, if you have questions, don't hesitate to talk to your family medicine or OB doctor, because the proven risks of untreated fever, migraines, or severe pain can outweigh the theoretical risks of Tylenol. Science certainly evolves, but right now, the balance of evidence, even the author of the study used by RFK Jr., says Tylenol is safe enough for occasional use in pregnancy when necessary. The association truly becomes strongest after 4 weeks or even longer of use. Trump and RFK took a complicated, unsettled area of research and oversimplified it into a scary narrative for their own benefit. That's not helping anyone. If you want a deeper look into who RFK Jr. really is, click here, as I'm sure it'll give you a sense of how these narratives keep repeating themselves. For now, stay informed, stay skeptical, and as always, stay happy and healthy.